Alright, my name is Joe Guillen, and today I will be demonstrating the 3 steps of doing a med check and explaining what a medication reconciliation is. Alright, my name is Joe. I'll be the nurse taking care of Mr. Jack-O-Lantern today. This patient came in with a hypotension emergency, and so with that, the physician had ordered a few meds, and so we're going to go ahead and compare these meds to the patient's home medications. So the patient is taking hydrochlorothiazide 25 milligrams PO at home, and the patient is also taking lisinopril 20 milligrams PO at home. So both of those meds the physician has ordered, so we just wanted to make sure that nothing gets duplicated or anything like that. So with that being said, that is the end of the reconciliation. So we're going to go ahead and follow the MAR, which is where we can see the physician's orders for medications, and we're going to start with the first medication check. So the first check is hydrochlorothiazide, 25 milligrams PO. We have available to us in the med cart 25 milligrams per tab, so we were going to need to give 1 tab today. Lisinopril 20 milligrams PO. We have available 20 milligrams per tab, so we will also need 1 tab for that. Next, we will be given heparin 5,000 units sub-Q. We have available to us 5,000 units per milliliter, so we're going to give 1 milliliter of heparin sub-Q every 12 hours. Next, we have hydromorphone 2 milligrams IM ordered for PRN back pain. We have available to us 2 milligrams per milliliter, so we'll be given 1 milliliter of hydromorphone. And lastly, the physician had ordered a TB skin test, so we will need to give, we have available to us 5 TU per 0.1 milliliter. So we will be giving 0.1 milliliter of the TB skin test intradermally today. So after going over the MAR, we're going to go ahead and take these medications out of the drug cart. And with that, we need to always check we want to be checking the orders along with the expiration date, and we just want to make sure we do the patient's 6 rights, which are the right patient. So we will be pulling meds for Mr. Jack-O-Lantern today. So we're going to do the right route, the right drug, the right time, right documentation, and let's see, right drug, right time, right route, right documentation, and my goodness, sorry, I can't remember the 6th check. So we'll be going right patient, right route, right drug, right time, right documentation. Sorry. So we're just gonna go ahead and continue. The first drug we're gonna go ahead and pull out is hydrochlorothiazide. The physician had ordered 25 milligrams per tab, so we're gonna get 1 tab ready for him. The expiration date for the hydrochlorothiazide is 6/23/2020. So we're gonna go ahead and get that, put that aside. The second medication is gonna be lisinopril, 20 milligrams per tab that the physician ordered. So we've got the 1 tab here, and that expires 5/26/2020. Okay, so those medications are good to go. The next medication will be heparin 5,000 units sub-Q. So we're going to go ahead and pull that out. The heparin is right here. So we're going to compare this, what's on the vial, to the doctor's order. So we've got heparin 5,000 units per milliliter sub-Q. And the expiration date is 8/12/2020. The next drug is going to be hydromorphone 2 milligrams. So let's get that hydromorphone. So we need hydromorphone 2 milligrams per milliliter IM injection. So we need hydromorphone 2 milligrams IM injection. And this expires 5/26/2020. All right, and the last medication or vaccine will be the TB skin test. So we need to get ready 5 TU per 0.1 milliliters. So we're about to check that. So here we have the TB skin test vial available to us the order is 5 TU per 0.1 milliliter intradermal, and this expires 6/23/2020. All right, so with that being the end of the first check, we're gonna go ahead and so now we would leave the first check is done in the med room, and next we will do the second check, which is done outside of the patient's room, and the third check is done right inside the patient's room right before you give the medications to the patient. So we're going to go ahead and leave the med room, and we're going to stand outside of the patient's room and perform our second check and begin to draw up these medications for the patient. So before we do anything like that, we need to do hand hygiene. Okay, so I've done my hand hygiene. So next we're going to go ahead and check all these meds again. Before we want to start drawing up any meds or anything like that, or gathering supplies, we want to go ahead and assess the patient's vital signs and lab values just to make sure that these drugs are okay to give with the condition that the patient is in. So we went ahead and got vital signs already. The patient's temperature is 98.8, pulse is 90, respirations is 20, O2 saturation is 96, blood pressure is systolic 172, diastolic is going to be 94, and the patient has a pain rating at an 8 for lower back. Patient states it is a throbbing, burning pain. So he has an 8 on a scale of 0 to 10. The patient's labs are all good for the most part. His creatinine is a little elevated. Normal creatinine is 0.5 to 1.2. The patient has a creatinine of 1.7, so we want to be careful with that. The patient's GFR is less than 60. It's at a 45. So we just want to be careful with the medications we're giving. All right, so we're going to go ahead and begin getting these meds ready for us. All right, so let's start at the top with. So I've gathered a medication cup, and here's my sharps container for later. All right, the first medication is going to be the hydrochlorothiazide, 25 milligrams per tab. So hydrochlorothiazide, 25 milligrams per tab. This will be given PO, and he will be receiving 1 tab. And when given hydrochlorothiazide, you want to be careful because it is a potassium excreting diuretic. So you want to watch with the electrolyte imbalances, most importantly hypokalemia and hypercalcemia. So we'll open this and set it here in the med cup. Next is the lisinopril 20 milligrams PO tab. So lisinopril 20 milligrams PO tab. Expiration date 5/26/2020. Okay, lisinopril is also a blood pressure medication. We will be giving it because this patient came in for a hypertension emergency. All right. And with the lisinopril, you want to assess the blood pressure because it will drop the blood pressure. And it could drop it below the range we're wanting, so you always want to assess that. All right, heparin 5,000 units sub-Q. So we're going to 5,000 units sub-Q per milliliter. So we will need to draw up 1 milliliter of heparin. Where's my heparin? Okay, so here's my heparin. 5,000 units per milliliter sub-Q. It expires 8/12/2020. Okay, so we're gonna draw up this heparin. We will be giving 1 ml, so we're going to use the 1 ml syringe today. And this is a high alert drug, so when drawing up the medication, you don't want to take it out just yet. You will need a second nurse to come and check just to make sure you have the right dosing. So we'll be drawing that up. So with the alcohol pad, we would clean the vial, the top of the vial, in a circular motion. All right, and then we will come in a dart-like motion, flip it up, and go ahead and we will be drawing up 1 ml of heparin, or 5,000 units. So okay, so I will have my second nurse check this for me. Sorry, the numbers are a little worn off just from practicing, but you can kind of tell. So I've got 1 ml there. So we'll take this out. And you never want to pick it up or cap it like that, so you will kind of scoop it up like this, just to make sure it's in safely. Next, we will grab a piece of tape, and we will label this just so we don't lose it, or we're reminded by what we're given and don't mix it up. So this is 5,000 units. Per mil of heparin. Okay, so we will go ahead and set this here, put it on our little tray, and we'll go ahead and place our pills there as well. All right. The next medication that we need to give or draw up and get ready for the patient is going to be hydromorphone, his pain medication or Dilaudid. The importance when given this, it is quite a high dose. The patient's oxygen saturation is only at a 96, which is normal, but with given this much of hydromorphone, it could potentially send the patient into respiratory distress. So we always want to assess the patient's oxygen saturation and his respirations. All right, so we will be needing 2 milligram IM injection of hydromorphone. So we have available 2 milligrams per milliliter. So we will be needing to draw up 1 milliliter. Okay, so here's the ampule. For the purpose of this video, we will not be breaking the ampule drawn out of it. But I will demonstrate how to properly break an ampule. You could get a gauze piece or an alcohol prep pad or anything like that insert it and you want to break away from you, always make sure that sometimes the medication could get stuck up here, and you just want to get that out of there to get the full dose of the medication. So it will not be drawn out of the ampule, but I will go ahead and check the order on it. So we need to give 2 milligrams per milliliter IM injection, and it expires 5/26/2020. So the what I would use to draw up the hydromorphone, I would use a 3 ml syringe, a 18 gauge filtered needle. The purpose for the filtered needle when you break the ampule is to just make sure that you don't get any glass or anything like that into the syringe. And then I will need a 22 gauge needle for the injection of the patient. So I'm going to go ahead and draw up with the filter needle. I'm going to draw up. I will be using this file just for the purposes of this video. So I need to draw up 1 milliliter. Alright. And there I have 1 milliliter. So we're going to recap that with the filtered needle. And so now we will take the filter needle off. Okay. And we will go ahead and put the 22 gauge needle on. You want to be careful not to touch the top of the catheter, just so you don't contaminate anything. Alright, so filter needle's gone. We have the 22 gauge needle on, and so our Dilaudid is ready to give. So now we're going to go ahead and label this just for our safety and the patient's safety, so we don't get anything mixed up. So we have Dilaudid or hydromorphone, 2 milligrams per milliliter. Okay, we've got 1 milliliter. Okay, so this is ready. We'll put this here on our little MedPass tray. All right. And lastly, we'll be drawing up a TB skin test per the physician. Let's see. So we have ordered 5 TUD intradermal per 0.1 milliliters. So today we'll be drawing up 0.1 milliliters of the TB skin test. Alright, so TB skin test, 5 TU per 0.1 milliliters intradermal. It expires 6/23/2020. So here I will use a alcohol pad because it will be a multi-use vial. And I will be using the 1 ml syringe. And because it is a multi-dose vial, you want to draw up 0.1 mils of air and go ahead and inject it into the vial. So I have drawn up 0.1 mils of air. I'm going to take off the needle cap. I'm going to come in like this. You're going to inject the air, and now we will draw up 0.1 mils of the TB skin test. So there we have 0.1 mils of the TB skin test. Okay. Again, you never want to put the cap on back in the air. You want to scoop it up. We're going to go ahead and label this. So 5 TU per 0.1 mils TB skin test ID. So TB skin test. Alright, and that concludes check 2. So now I'm going to go ahead, and this is the part where we go ahead and take our little med tray and enter the patient's room. So we are going to go ahead and knock before coming in. Okay. Hand hygiene and put on some gloves. Hey, Mr. Jack-O-Lantern, my name's Joe. I'll be your nurse this morning. Can I see your wristband just to verify your name and date of birth? Alright, Jack-O-Lantern. Good, everything's good. Do you have any drug allergies or anything like that? No known drug allergies? Good. So, alright. So here are some meds that the physician had ordered for you. And we're going to go ahead and give these to you. Is that okay? As we give them to you, I'll go ahead and explain what they are used for. So, the first medication we're going to give you is hydrochlorothiazide. That is your water pill. What it's going to do, it's going to make you pee quite a bit. And the purpose for this is you do have high blood pressure, so it's going to bring down your blood pressure. Okay, the importance with this is not to get up quick and just rise in stages, or if you need to get up, just call and we'll help you get up. So I'm going to go ahead and put this in the cup. Because it is a water pill, it's going to make you pee quite a bit. If you could just let us know when you have to pee, we're going to have to go ahead and have to keep track of what you drink and what you pee and stuff like that, okay? All right, good deal. So there's the hydrochlorothiazide. Mr. Lantern, the next pill, or I'm sorry, let's go ahead and take this, okay? So there's that. All right, take that pill for me. Okay. Good. Can you go ahead and open your mouth just so I can double check that you swallowed it? Good. So that was 2 ounces of water that you just consumed with that, okay? That's fine. Next is going to be your next pill, lisinopril. And this is this is also a blood pressure medication, okay? So kind of the same teaching with your water pill, because it will lower your blood pressure. We just want to make sure that that you're safe, and so whenever you do need to get up, please again just give us a call and we'll come help you, okay? Alright, so we go ahead and let you take this medication. There we go, Mr. Lyon. Here's 2 more ounces of water. Alright, good. Can you mind opening your mouth one more time for me? Alright, good deal. Thank you, sir. So those are all the pills we have for you today. Now we do have a few injections. I'm sorry. The first injection is going to be heparin. What that is, it's a blood thinner. The physician would like us to give that to you just because you've kind of been in bed a few days, okay? And we just want to prevent any blood clots getting any bigger or from forming any new blood clots, okay? It is important because it is a blood thinner. You do bruise very easily. So if you just let us know if you've noticed any bruising, it's extremely important that you know or that you notify us if you've noticed any dark stools. Okay, what that is, that's indications of a upper GI bleed. So that is a pretty serious thing. So if you just let us know with that, okay. And so the heparin is here. So we're gonna go ahead and give this to you. Have you had heparin before? No. Okay, so the deal with heparin, it goes in your abdomen, okay, and one of the four quadrants of your abdomen. It is important to rotate sides. So for this first time, okay, we're gonna go ahead and give it in your right upper quadrant. So we'll go ahead and give this to you real quick, okay? I'm going to empty this out real quick. So when giving heparin, I'm going to just kind of pinch your little belly fat you have here, okay? We're going to give it 90 degrees. And it's important because of the easy bruising that you don't massage it, okay? So just a little poke here. Good. All right, good deal. Alrighty. Next is going to be your pain medication, okay? Your 100 morphone. We're gonna give this to you because earlier you stated that you had a pain rated at an 8. Okay, so that's pretty severe. I understand you're hurting pretty good right now. Okay, so we're gonna go ahead and give this to you. With this medication, there is chance that it might lower your O2 saturation, okay? Because it's a pretty strong pain medication. So we're going to watch your oxygen saturation as well as your respirations, okay? I will be giving this in so I will be giving you 2 milligrams of it, okay? That's what the physician ordered. And I will be giving it to you in the vastus lateralis, I think. So we're gonna go ahead and uncap this. All right, so I'm going to give you 1 milliliter. And it's important to know this landmarking just because you want to be sure that you don't hit any vessels or nerves. And it's important to aspirate to make sure you don't hit any vessels. Okay, so we're going to come in between my fingers here. And before we give it, we're going to aspirate. Okay, good, no vessels. So now we're going to go ahead and give this. All right. And if you are a little sore, Mr. Leonard, it is okay to go ahead and massage this area. All right. Last, Jack here, the physician had ordered a TB skin test for you just because you recently got done with chemotherapy treatment a few days ago. And with that being said, it's going to obviously weaken your immune system, and you are immunocompromised just because of where you work. We appreciate you working at the homeless shelter and volunteering everything that you do, but we're gonna go ahead and give this TB skin test, okay? It is important. It will give like a little bleb, a little bubble under your skin, but it is important that you don't scratch it, you don't rub it, massage it, anything like that. If you do that, it could cause it to redden, and it will give us a false positive. Okay, so we need you to come back in 48 to 72 hours, approximately around the same time, okay, just to have it read by us. All right, so we're gonna go ahead and give this to you. and it is 0.1 of the TB skin test. All right. I'm giving this, you always want to make sure bevel is up. We will be giving it in the forearm. It could be given in the clavicular area or as well as the scapular area. But for this purpose, we're going to go ahead and give it in his forearm. You want to hold the skin taut, 10 to 15 degree angle, bevel up. And you don't need to stick the whole needle in, just basically the bevel. Okay, so there's that. Skin is taut, 10 degree angle, and in we go. Okay. Very slow. It does hurt a little bit, I'm sorry. Alright. So there you see the little bleb that it made. We want to go ahead and bring this out in the sharps container. With the other two medications, I did cap them. I know I'm not supposed to, just a habit, but you never want to recap a medication. You always just want to go straight into the sharps container. Alright, Mr. Landon, so that is all for your medications this morning. I'm going to go ahead, for your safety, I'm going to go ahead and put both your side rails up and lower your bed for you, okay? I have to make sure that your bed is locked, just so when you do try to get up, it doesn't go anywhere, just to ensure for your safety. Here is your call light. If you need to pee or get up, anything like that, have any questions, feel free to call us, okay? All right, Mr. Leonard, it's been a pleasure. We'll come see you later. All right, and so I will perform hand hygiene after taking off my gloves. All right, and for documentation, we want to document what time the meds were given, the 6 rights of the patient, and of course the patient's input and output. Patient did have 4 ounces of water with his pills this morning, so we'll need to document that. And that is all for this video.